need to use an approved of concertina method. That's the ideal, that's the evidence-based way to pack a kit, shall we say. So for argument's sake, I'm just going to put a couple of these less kind of big ones and clunky ones in here. You obviously have your handles normally facing to the edge for security, but this part doesn't hugely matter. You can lay it on swabs or put the swabs on afterwards. That also doesn't hugely matter. I prefer swabs underneath because I think it makes like a little bed for the instruments, but it's up to you really. The main thing is how you fold it. So bring your kit, or your drape, sorry, into your instruments, fold it back on itself, like you're almost kind of making an S shape, and then when you reach this point, the outer edge, okay, needs to always be tucked in like underneath. Does that make sense? So that then actually someone can come, the idea is the surgeon can come from underneath and kind of do this and pull it outward and not have to cup their fingers that way, touching a lot more surface. Yes, they'd be gloved. Yes, we'd be passing this into them in a sterile manner. But the whole idea is there's a much bigger risk of a break in sterility there than if they've got a little tab ready to just put it back on themselves. Does that make sense? So you want to imagine you're always keeping the principle is because in some practices it isn't the surgeon that opens their kit, which is what most of you will have. It is a scrub nurse or a scrub professional or someone who's gone in to prepare their kit for them, and they would touch just the very edge of that, having touched none of the rest of the kit, and then the surgeon in theory won't come back by that edge. So it doesn't really matter. Does that make sense? Obviously in a sterile manner they would have touched it. Or the other option is, some of you may have heard of them, certain things called cheetal forceps. Cheetal forceps are used for scrubbing and can be used for this very purpose. They're sterile on the end. And so a scrub nurse would capture that end with cheetal forceps and pull it open. Again, if it was folded like that, so it finished in on itself, that's going to be much harder and a much higher risk of a break in sterility with those forceps. So just to do it fully through, bring it against your instruments, leave yourself your folded upper edge, repeat on the other side, and then it's once you know that you're leaving that edge kind of facing outwards, shall we say, then it's just a case of completing it. And you can fold it however you like. Obviously this is quite a small kit, so I'll be done for now. And then I would personally secure that with a bit of Dick tape, good old Bowie Dick tape, and then that would be me done.